Why your stomach feels heavy after small meals. Most people think a heavy stomach after eating means they ate too much. A big dinner, too much bread, too much fried food, eating too fast. And yes, those things can absolutely make the stomach feel heavy. But here is where people get fooled. If your stomach feels heavy after small meals, the problem may not be the size of the meal. The problem may be how slowly your stomach is emptying, how sensitive your upper digestion has become, or how much pressure is building inside your abdomen. In other words, you may not be eating a huge amount, but your body may be processing it like a heavy load. After 50 or 60, this matters more because digestion can become less forgiving. Muscle movement in the gut may slow down. Blood sugar problems may affect nerves. Medications may change stomach movement. Constipation may create pressure from below. Acid reflux may make small meals feel uncomfortable. And stress can make the gut more sensitive. Now, this does not mean every heavy stomach is dangerous. Many causes are common and treatable. But if this keeps happening, especially if you feel full after only a few bites, your body is giving you a clue. One of the biggest hidden reasons is delayed stomach emptying. Your stomach is supposed to receive food, mix it, grind it down, and slowly release it into the small intestine. But when that movement becomes too slow, food can sit in the stomach longer than it should. That can create fullness, pressure, bloating, nausea, burping, reflux, and that heavy food is just sitting there feeling. Mayo Clinic lists gastroparesis symptoms such as feeling full after eating just a few bites, feeling full long after eating, bloating, nausea, vomiting, acid reflux, appetite loss, weight loss, and changes in blood sugar levels. This is where it gets interesting. You may not have eaten much, but if the stomach is emptying slowly, even a small meal can feel like a large one. Most people miss this because they only think about digestion in terms of acid. They say maybe I have too much acid, but heaviness after small meals is not always an acid problem. Sometimes it is a movement problem. And after 50, delayed stomach emptying can be linked with diabetes, blood sugar swings, certain medications, infections, surgery, nervous system issues, or sometimes no clear cause at all. NIDDK notes that gastroparesis can cause feeling full shortly after starting a meal or long after eating, and diabetes is one of the possible causes. This does not mean you should diagnose yourself with gastroparesis. But if you feel full very quickly, stay full for hours, feel nauseated, or sometimes vomit food eaten earlier, that is not something to keep ignoring. Another common reason is functional dyspepsia. That sounds complicated, but it basically means the upper stomach area feels uncomfortable even when no clear structural disease is found. The stomach may be more sensitive. The nerves may overreact. The stomach may not relax normally after meals. So a normal amount of food can feel like too much. Functional dyspepsia can cause upper belly burning, pain, bloating, belching, nausea after eating, and an early feeling of fullness. Mayo Clinic describes early satiety and post-meal bloating or nausea as symptoms of functional dyspepsia. This is where people get fooled. They expect a scan or test to show something dramatic. But sometimes the issue is not a visible blockage or ulcer. Sometimes it is the way the stomach and brain are communicating. Your gut has nerves. Your stomach stretches. Your brain receives signals. If those signals become too sensitive, a small meal may feel heavy, tight, or uncomfortable. Stress can make this worse. Not because the symptoms are imaginary, but because the nervous system and digestive system are connected. When your body stays in a tense, alert state, digestion can become less smooth. You may swallow more air, tense your abdomen, eat faster, or become more aware of every sensation. Most people hear stress and think the doctor is dismissing them. But stress does not mean fake. It means the gut is responding to the nervous system. Another reason small meals feel heavy is eating foods that slow stomach emptying. Fat slows digestion. That is not automatically bad. Healthy fats are important. But high-fat meals can stay in the stomach longer. Fried foods, heavy cream sauces, greasy meats, cheese-heavy meals, pastries, and large portions of nuts or oils can all make the stomach feel heavier. And this matters more after 50 because the stomach may already be slower or more sensitive. A small meal that is high in fat can feel heavier than a larger meal that is lighter and easier to digest. This is why some people say, I barely ate anything. But the meal was a small amount of very rich food. A few bites of fried food, creamy pasta, pizza, or dessert may sit heavier than a simple bowl of soup or grilled fish with vegetables. The answer is not to avoid all fat. The answer is to notice which foods your stomach handles poorly. If heaviness happens after fried meals, creamy foods, large portions of cheese, heavy meat, or late night desserts, your stomach may be telling you that meal is too slow for your digestion right now. Another overlooked reason is constipation. Most people do not connect constipation with a heavy stomach after small meals. But the digestive tract is one long system. If the lower gut is backed up, gas and pressure can build. The abdomen may feel tight. The stomach may feel like it has less room. Eating even a small meal can trigger bloating, pressure, and discomfort. This is where people get fooled. They focus only on the stomach. But the issue may be lower down. If you are not having regular bowel movements, if stools are hard, if you strain, or if your belly feels full before you even eat, constipation may be part of the heaviness. After 50, constipation can become more common because of lower fiber intake, dehydration, less movement, medications, thyroid slowdown, diabetes, calcium or iron supplements, pain medications, and changes in routine. A practical early step is simple. Do not just ask, "What did I eat?" Ask, "Am I eliminating normally?" Because if your gut is not moving well, every meal can feel heavier than it should. Another reason is reflux, or irritation in the upper stomach. Acid reflux does not always feel like burning. Sometimes it feels like pressure, fullness, burping, nausea, throat clearing, chest discomfort, or a heavy sensation after eating. If the valve between the stomach and esophagus is not working well, or if the stomach is under pressure, acid and food contents can move upward. This can happen after large meals, but it can also happen after small meals if the stomach is sensitive, if you lie down too soon, if you eat late, if you have a hiatal hernia, or if the meal contains triggers like fried food, chocolate, mint, coffee, alcohol, spicy food, or acidic foods. Most people miss this because they think reflux must burn. But reflux can show up in quieter ways. If the heavy feeling comes with sour taste, burping, throat mucus, cough, hoarseness, or discomfort when lying down, reflux may be part of the picture. Another important reason is blood sugar and nerve function. This matters especially for people with diabetes, prediabetes, long-standing high blood sugar, or numbness and tingling in the feet. High blood sugar over time can affect nerves, including nerves that help control stomach movement. That can make digestion less predictable. This is where people get fooled. They think blood sugar only affects thirst, urination, and weight. But blood sugar can affect the gut too. If the nerves that coordinate stomach emptying are affected, food may leave the stomach more slowly. That can cause fullness, bloating, nausea, and blood sugar swings. If you already have diabetes and feel heavy after small meals, it is worth discussing this with your clinician. The stomach and blood sugar can influence each other. Slow stomach emptying can make it harder to predict when glucose from food will enter the bloodstream. Another hidden cause is medication. Many medicines can affect digestion. Some pain medicines, especially opioids, can slow the gut. Some diabetes medicines can slow stomach emptying. Some antidepressants, bladder medicines, iron supplements, calcium supplements, and certain heart or blood pressure medicines can contribute to constipation, nausea, or fullness in some people. Do not stop medication on your own, but if the heavy stomach began after starting a new medicine or changing a dose, that timeline matters. Most people do not mention digestive heaviness because they think it is not important, but your clinician needs to know. Sometimes the solution is not another stomach pill. Sometimes it is reviewing the medication pattern. Now there is one serious point we need to include. Feeling full quickly after small meals can sometimes be a warning sign that needs evaluation, especially if it is new, persistent, or getting worse. Mayo Clinic lists feeling full after eating small amounts, bloating after eating, loss of appetite, nausea, vomiting, weight loss without trying, black stools, tiredness, and trouble swallowing among symptoms that can occur with stomach cancer. Although these symptoms are more often caused by other conditions, that does not mean you should panic. Most people with a heavy stomach do not have cancer. But if you have unexplained weight loss, vomiting, black stools, blood in vomit, trouble swallowing, worsening pain, anemia, severe fatigue, or a new loss of appetite, do not treat it like simple indigestion. Get medical care. This is where people get fooled. They wait because the symptom feels mild. But persistent early fullness is a symptom worth taking seriously when it is new or paired with red flags. So what can you do starting today? First, slow the meal down. Eat smaller bites. Chew well. Put the fork down between bites. Give your stomach time to signal fullness. Many people eat quickly, swallow air, and overload the stomach before the brain catches up. Second, Make small meals lighter, not just smaller. A small fried or creamy meal may sit heavier than a larger simple meal. Try meals built around lean protein, cooked vegetables, soups, oatmeal, yogurt if tolerated, fish, eggs, or softer foods that your stomach handles better. If raw vegetables make bloating worse, try cooked vegetables instead. Third, avoid lying down right after eating. Stay upright for at least a couple of hours if reflux or heaviness is an issue. A gentle walk after meals can help digestion and blood sugar. You do not need a workout, you just need movement. Fourth, look at fiber carefully. Fiber is important, but adding a huge amount suddenly can increase bloating. Increase slowly. Drink enough fluid. If constipation is part of the problem, fiber, water, walking, and routine can help, but some people need medical guidance. Fifth, track your pattern for 1 week. Write down what you ate, how fast you ate, when the heaviness started, whether you burped, felt nausea, had reflux, had bowel movements, or felt full for hours. Patterns reveal what memory misses. Sixth, ask for help if it persists. If heaviness after small meals keeps happening, especially with early fullness, nausea, vomiting, weight loss, trouble swallowing, black stools, anemia, or worsening pain, talk with a clinician. Evaluation may involve checking medications, blood sugar, thyroid, blood counts, reflux, ulcers, gallbladder issues, stomach emptying, or other digestive causes depending on your symptoms. The main message is simple. Your stomach may feel heavy after small meals, not because you are weak, not because you are imagining it, and not always because you ate too much. It may be because your stomach is emptying slowly, your upper gut is more sensitive, your meal is harder to digest, constipation is creating pressure, reflux is irritating the system, blood sugar is affecting stomach nerves, or medication is changing gut movement. Do not ignore the pattern. A heavy stomach is not just a food complaint. It is a signal about movement, nerves, pressure, digestion, and sometimes deeper health. So listen early, eat slower, choose lighter meals, walk gently after eating, fix constipation, watch your triggers, review medications, and get checked if the symptom is new, persistent, or comes with warning signs. Because sometimes the problem is not that your stomach is too full. Sometimes the problem is that your stomach is asking for help moving food forward again.